Hello everyone, it's Dr. Locklear here, and I'm coming to you today with the Exemplar 9C Influenza. And this falls under the concept of infection. And this begins on page 606 of your Pearson text. And the flu is something that we all have in common. You've either had the flu or I'm sure you've known someone that's had the flu. And you can die from the flu. It's very difficult to treat in some patients, especially children. And so it's not anything to be taken lightly. So let's get started. So we're going to describe the pathophysiology of the influenza. We're going to look at how does it come about? What causes the flu? What is the etiology? What are the risk factors? How can we prevent it? What puts us at risk for catching the flu? Identify clinical manifestations. So when you do your nursing assessment, what will you see in this patient? Summarize the diagnostic tests and therapies that the interprofessional team uses when collaborating care. What are some of the tests that we do to identify flu? How do we differentiate care of patients across the lifespan? And how do we look at providing culturally competent care by using our nursing process? So let's look at our overview. Influenza or the flu is a highly contagious viral respiratory disease characterized by coryza, inflammation of the mucous membranes lining the nose, usually associated with nasal drainage. So you have stuffy nose and nasal drainage with it. It's very uncomfortable. Fever, cough, and systemic symptoms such as headache and malaise. A vague feeling of physical discomfort. You feel very tired, achy all over. All you want to do is lay around and sleep. Influenza tends to be mild and self-limited in healthy adults. Children under the age of 5, older adults, those with compromised immune systems, and think about somebody that has HIV. They're very prone to getting flu and pneumonia. Pregnancy and people with chronic heart or pulmonary disease. However, there's a high incidence of complications, especially, like I said, with someone with pneumonia, and a higher risk for mortality related to the disease and its complications. Influenza usually occurs as an epidemic, widespread outbreak of an infectious disease, and we all know what pandemic and epidemic means because we are still living that with COVID. So epidemic's widespread and pandemic is global. Localized outbreaks of influenza usually occur approximately 1 to every 3 years. The most recent pandemic incidence of influenza was in 2009 with the H1N1 flu. H1N1 influenza, known as the swine flu, is a form of virus that consists of avian genes, human genes, and genes from flu viruses typically found in pigs from Asia and Europe. H1N1, like all flu viruses, spreads from human to human via airborne droplets. So, during COVID, we hardly had any flu because people were wearing masks, and it really kept the spread of the flu down. Avian influenza or bird influenza has also raised concerns about a potential future pandemic. The avian flu virus has demonstrated limited ability to spread between humans. However, the possibility that it will mutate to allow wider individual-to-individual spread is of concern. This viral strain has a mortality rate of greater than 50% in people who have been infected as a result of close association with infected birds. And so look at box 9-4 on page 607, and it gives you a focus on influenza and its potential for a pandemic happening. So just read over that, okay? So our pathophysiology and etiology. The incubation period for influenza is short, only 18 to 72 hours. So you can be exposed, and within up to 18 to 72 hours, you can be sick with the flu virus. The virus infects the respiratory epithelium. It rapidly replicates in infected cells and is released to infect neighboring cells. The resulting inflammation leads to necrosis and shedding of serous and ciliated cells of the respiratory tract, a process that allows extracellular fluid to escape, producing rhinorrhea, or that runny nose that you have. With recovery, serous cells are replaced more rapidly than ciliated cells, and the result is continued cough and coryza. Again, coryza meaning inflammation of the mucous membranes lining the nose. With recovery, serous cells are replaced more rapidly than ciliated cells, and the result again is that cough and coryza. Systemic symptoms of influenza are likely caused by release of inflammatory mediators as the influenza infection activates humoral and cell-mediated immune responses. So it also can activate those cells that can cause you to have like an allergic type reaction, such as a stuffy nose and the coughing and that type of thing, the nasal drainage. The respiratory epithelial necrosis caused by influenza increases the risk for secondary bacterial infections. Sinusitis and otitis media, which is ear infection, are frequent complications of influenza. Tracheobronchitis, which is inflammation of the trachea and bronchi, may develop. Although tracheobronchitis is not a serious health risk, that manifestations may persist for up to 3 weeks, and you just cough and cough. It's actually just very irritating. Influenza is clearly linked to an increased risk for pneumonia, particularly in young children and older adults, because we're aging and we have a decrease in our immune system, and children, their immune system's just not quite mature enough yet. Narrower airways and underdeveloped alveoli increase the risk for pneumonia in young children. Changes in respiratory function associated with aging, including decreased effectiveness of cough and increased residual lung volume, the volume of air remaining in the lung after exhalation, pose little risk in the healthy older adult, but greatly increase the risk for pneumonia when associated with the flu. Primary influenza, viral pneumonia, while uncommon, is a serious complication that may be fatal. It typically develops within 48 hours after the onset of influenza, often in patients with pre-existing heart valve or pulmonary disease. Influenza pneumonia progresses rapidly and can cause hypoxemia and death within a few days. Bacterial pneumonia is more likely to occur in older at-risk adults, but also may affect otherwise healthy adults. It usually presents as a relapse of influenza. You'll have a productive cough and evidence of pneumonia on the chest x-ray. Other respiratory complications of the flu include exacerbation of COPD, chronic bronchitis, or asthma. Another condition is Reye syndrome, is rare but potentially fatal complication, a neurologic disease that typically occurs following a viral infection. It is more likely to affect children, but also has been identified in older adults. It is associated with administration of aspirin products to children with any viral infections. We really do not need to be giving aspirin to children because of this possibility of Reye syndrome. Most often associated with influenza B virus, Reye syndrome develops within 2 to 3 weeks after the onset of the flu. It has a 30% mortality rate. Hepatic failure and encephalopathy develop rapidly in patients with Reye syndrome. Other potential complications of the flu, while uncommon, are myositis, inflammation of skeletal muscles, myocarditis, inflammation of the heart muscle, and central nervous system disorders such as encephalitis and Guillain-Barré syndrome as well. The flu is nothing to be taken lightly. Etiology, so what causes it? Influenza virus is transmitted by airborne droplet and direct contact, so we can breathe it in. Influenza A is responsible for most infections and for the most severe outbreaks of the flu. This is primarily a result of its ability to alter its surface antigens, bypassing previously developed immune defenses to the virus. It's strong, and it can overtake your defenses because of the nature of the virus itself. New strains of influenza viruses are named according to the strain, geographic origin, and year the strain was identified. Surface antigens of specific virus may be used to further differentiate influenza A. Outbreaks of influenza B viruses are generally less extensive and less severe than those caused by influenza A virus. Illness associated with influenza C virus is mild and often goes unrecognized. Type A influenza viruses are found in birds, pigs, whales, and humans and are believed to have caused 4 pandemics. 1918, and that was the Spanish flu, which wiped out a lot of people, in 57, 68, and 2009. Type B influenza viruses are commonly found among humans and are often responsible for influenza outbreaks but not pandemics. Type C influenza viruses are found in humans, pigs, and dogs, typically cause mild respiratory infections. So you have type A, type B, and type C. Risk factors. Individuals at increased risk for influenza or its complications are the infants, young children, and anyone aged 50 or older. Residents of nursing homes or other long-term care facilities are at increased risk because of their age, as well as the increased risk of exposure from others, residents, visitors, and to healthcare providers, because they're in and out all the time. Patients with chronic disorders, especially diabetes and cardiac, renal, or pulmonary disease, are more susceptible. Pregnant women, particularly during the second and third trimester, are also at increased risk of complications. As with any infection, patients with weakened or compromised immune systems, such as AIDS, receiving treatment for cancer, or taking immunosuppressive medications are at greatest risk because our immune system's compromised when you're in those situations. Healthcare providers who work in a facility where they are likely to be exposed to influenza virus, and child care providers or others who have close contact with infants and young children also face greater risk as well. So a lot of risk factors here. So prevention, how do we prevent it? The predominant strain of influenza virus varies from year to year. Therefore, a new vaccine formulation is prepared yearly, which incorporates antigens of the influenza strain predicted to be the most prevalent for the upcoming flu, typically the winter months, because we're more inside and we're closer together. The vaccine contains egg protein and is not recommended for people who have a severe allergy to eggs or who have previously experienced a severe hypersensitivity response to the vaccine. The vaccine is given in the fall before the annual winter outbreak. Live attenuated vaccine administered by intranasal spray is available for healthy people under age 50. The effectiveness of the vaccine varies from year to year. In 2012 to 2013, seasonal flu vaccine, which contained vaccines against 2 influenza A viruses and 1 influenza B, was estimated to have a vaccine effectiveness rate of 56%, with effectiveness in the older population 65 and older. So sometimes, it's not always 100%. We take the vaccines, and hopefully when we do, we'll have a milder reaction to the virus itself. Although the CDC has recently changed its recommendations to include all individuals for annual influenza, annual immunization is especially recommended for at-risk patients, including people older than age 65, residents of nursing homes, adults and children with chronic cardiopulmonary disorders such as asthma or chronic metabolic diseases such as diabetes, and healthcare workers who have frequent contact with high-risk patients. And then family members of an at-risk patient should be vaccinated as well, because all healthcare workers, most of your facilities are going to require this. Approximately 5% of individuals who are vaccinated experience mild symptoms of low-grade fever, malaise, or myalgia for up to 24 hours after vaccination. Serious adverse reactions to influenza are rare. Guillain-Barré, an acute neurologic disorder characterized by muscle weakness and distal sensory loss, has been associated with these. Many may fear a reaction from the vaccine, even though these vaccines are highly purified and reactions are rare. So what are your clinical manifestations? Look on page 609, and you will see the clinical manifestations of the influenza. And it gives you the nasopharyngeal inflammation, upper respiratory, viral, Reye syndrome, and Guillain-Barré. Please read over that. Infection with influenza viruses produces one of 3 syndromes: uncomplicated nasopharyngeal inflammation, viral upper respiratory infection followed by bacterial infection, or viral pneumonia. The onset is rapid, profound malaise, so you just feel very fatigued, you're weak, you just have no energy, you just want to lay around, and your body needs to sleep to rejuvenate. This malaise may develop in a matter of minutes. Manifestations of influenza include abrupt onset of chills and fever, malaise, muscle aches, and headaches. Respiratory manifestations include cough, sore throat, substernal burning, and coryza, that nasal congestion. The cough may be severe and either dry and non-productive or productive. Acute symptoms subside within 2 to 3 days, although fever may last as long as a week. Along with fatigue and weakness, the cough can persist for days or several weeks. Sometimes you just feel like you never get over having the flu. Again, the symptoms are rapid, and chills, fever, malaise, muscle aches, headache, and then respiratory is cough, sore throat, substernal burning, and that coryza or nasal congestion. The cough may be severe. Acute symptoms may subside within 2 to 3 days. Fever may last a week, or you may feel like you've had it for weeks. Collaboration. What is our focus? Medical treatment of influenza focuses on establishing the diagnoses, providing symptomatic relief, and preventing complications. Collaborative partners include local health departments, because it is a communicable disease. They need to know if there's an outbreak. Hospitals and urgent care centers, primary care and infectious disease clinics, school nurses, and other medical providers. So a lot of collaboration going on here. And you can go to the health department and get your flu shot. Diagnostic test. A chest x-ray and white blood count may be done to rule out complications such as pneumonia. The WBC count is commonly decreased in patients with influenza. Bacterial infections usually cause an increase in WBC count. If there is a local outbreak of respiratory infections, an influenza rapid diagnostic test can be used to determine whether influenza is the cause of the outbreak or whether influenza is prevalent in specific patient populations. Nasal, throat, or nasopharyngeal swabs or washes can be used to obtain specimens for diagnostic testing. Specimens should be obtained as early in the course of the disease as possible. Rapid diagnostic tests can produce results in 10 to 15 minutes, and they'll do the swab to go in and do that. What is our pharmacological therapy? The CDC is currently recommending the use of 2 antiviral drugs, Zanamivir or Relenza, and Tamiflu. Tamiflu's been around a few years now, and it does work if you get it early enough. These are used for the treatment and prophylaxis of influenza. These drugs may prevent the release of newly formed virus from the surface of infected cells and inhibit the replication of influenza A and B viruses. Other antiviral drugs that are available include amantadine, ranitidine, and ribavirin. Safety alert. Because it is given by inhalation, Zanamivir is contraindicated in patients with chronic respiratory conditions such as COPD or asthma. Other treatments, antiviral treatment should continue for 5 days. Patients with severe illness may be treated longer. For prophylaxis, those who have been exposed to influenza but not vaccinated should receive the vaccine along with the antiviral drug. Antivirals should be administered for 7 days after exposure. In long-term care facilities, treatment should continue for at least 2 weeks or until 1 week after the last case has been identified. Over-the-counter analgesics such as aspirin, but remember you have to be careful with that in children. Acetaminophen such as Tylenol and your NSAIDs, which is your non-steroidal anti-inflammatory drugs, provide symptomatic relief of fever and muscle ache. As mentioned earlier, aspirin should never be given to children because of the risk of Reye syndrome. Antitussives may decrease cough, promote rest. Antibiotics are not indicated unless it's a bacterial infection. Antibiotics do not work on viruses, so they don't prescribe them. Non-pharmacological therapy include bed rest to alleviate fatigue and malaise, boost the immune system, and prevent the spread of infection. Adequate fluid intake in the form of water, juice, warm tea, and that helps your throat too. That'll help soothe your throat. And soup is essential to prevent dehydration and reduce cough. Hygiene interventions to prevent the spread of infections should include adequate hand hygiene, proper disposal of infected waste materials such as tissues where you have to blow your nose, and proper disposal of infected waste materials such as tissues, and covering the nose and mouth when coughing. Other complementary approaches can be used, but they, as long as they're not contraindicated with the medicines that you are using. Lifespan. Individuals who are very young, less than 5 years or older than 65, are at higher risk for developing complications related to the flu infection, including viral and bacterial pneumonia and myositis, Raynaud syndrome, and exacerbation of chronic respiratory diseases. These complications increase the risk of mortality in these age groups, and mortality increases with age in the older population. You can die with the flu. Don't take it lightly. If you have the flu, you need to go see the doctor. Pregnant women. Flu is more likely to cause severe illness in pregnant women than in women who are not pregnant. Changes in the immune system, heart, and lungs during pregnancy make pregnant women and women up to 2 weeks postpartum more prone to severe illness from the flu, as well as to hospitalizations and even death. Pregnant women with flu also have a greater chance for serious problems for their unborn baby, including premature labor and delivery, because a lot of times when you have the flu, you have a fever. And if your fever goes up, it can cause you to go into preterm labor. And so depending on how far along you are, you may have a miscarriage. The CDC recommends that the best prevention is a flu shot with no indication of harm to the unborn child. So you can get the flu shot as long as there's not any major contraindications, but check with your doctor if you are pregnant before you go get it. Children. According to the CDC, the flu is more dangerous than the common cold for children, and flu places a large burden on the health and well-being of children and their families. Annual influenza vaccines is the best method for preventing flu and its potentially severe complications in the children. We need to get them vaccinated. Older adults, according to the CDC, individuals 65 years and older are at greater risk of serious complications from the flu compared to the young or healthy adults because human immune defenses become weaker with age. While flu season can vary in severity, during most flu seasons, adults 65 years and older bear the greatest burden of severe flu disease. In recent years, for example, it is estimated that 80% to 90% of seasonal flu-related deaths have occurred in people 65 years or older. And so the people who are, in their 60s or older than 65 are at greater risk, especially if they have other comorbidities. Nursing process. Stress the importance of the yearly influenza vaccination. We need to teach to get vaccinated. Teach about the spread of disease, including measures to reduce the risk for contracting influenza, such as thorough and timely hand hygiene and avoiding crowds and people who are ill. Stay away from these people. Stay in if you know you're sick, because you're spreading it too if you're out and about. Assessment. Unless there is a known outbreak of influenza in the community, it can be difficult to differentiate the manifestations of the flu from those or other respiratory and upper respiratory infections. A thorough nursing assessment should provide clues to help determine whether a patient's symptoms can be attributed to the flu. So observation and patient interview. Observe the patient for respiratory or cardiac symptoms to include the presence of dyspnea, the presence or absence of chest pain, and the nature of any productive cough. Assess and observe for facial pain or pressure in the patient's sinus areas. Ask the patient about known exposure to the flu. Have you been exposed to anybody that you know that's got it? Ask the patient to describe current symptoms, onset, and the duration. Also ask about all current medications and known medication allergies, the patient's history of the flu vaccine, and the presence of chronic diseases such as heart disease, COPD, and diabetes. And remember, if you have an allergy to eggs, you don't need to take the flu vaccine because it's got egg protein in it. Physical exam. Much information can be obtained through the physical exam. Observe the patient's general appearance, including skin color, skin temperature, take their temperature, and any presence of fatigue or malaise. Obtain vital signs, temperature, respiratory and heart rate. Assess the lung sounds and perform an abdominal examination. and ask, have you had any recent travel or interaction with anybody who's potentially affected or affected animals? Because remember, we know it comes from pigs and birds and certain animals. Diagnoses: ineffective airway clearance, ineffective breathing pattern. You could also have impaired oxygenation if they have a lot of inflammation or a lot of mucus. Risk for infection, ineffective thermoregulation because they run a fever. You can't sleep because you just feel so achy. Fatigue, and then ineffective coping and communications. Very debilitating. Planning. The patient's temperature will remain within normal limits. The patient will maintain normal fluid balance by increasing fluid intake. The patient's oxygen saturation will remain within acceptable limits. The patient will maintain patent airway. We want to make sure that they can breathe. Implementation. Severe disease or complications of influenza may necessitate hospitalization for respiratory support and management. For these patients, nursing care focuses on maintaining a clear airway, ensuring adequate ventilatory patterns, reducing the risk of infection, and promoting adequate rest. So how do we maintain an airway patency? Swelling and congestion of mucous membranes, extracellular fluid exudate, and impaired ciliary action as a result of cell damage increase the risk of impaired airway clearance during influenza. Older adults are at a particular risk because of normally reduced ciliary activity and increased lung compromise. The nurse's role in maintaining a patent airway include the following: assist the patient to maintain adequate hydration, assess mucous membranes and skin turgor for evidence of dehydration. Fever and decreased oral intake may lead to dehydration and increased viscosity of secretions. Thick, viscous secretions are more difficult to expectorate or cough up. So we need to keep fluid in them so it helps keep these secretions loose. Increase the humidity of inspired air with the bedside humidifier. Increasing the water content of inhaled air helps to loosen thick secretions and soothe mucous membranes. Teach effective cough techniques. Administer analgesics as ordered. The huff cough, a series of small, low-pressure coughs, is effective to maintain an open airway, such as like that. It don't have to be very forceful, but you can feel it in the back of your throat, clearing your throat. It is effective to maintain open airways and spares energy. Relieving muscle ache increases the ability to cough effectively. Safety alert. Monitor the effectiveness of the cough and the ability to remove airway secretions. Fatigue and general malaise may impair the ability to cough effectively and mobilize secretions. So you may have to get them an incentive spirometer. Ensure effective ventilation. Muscle aches, malaise, and elevated temperature may increase the respiratory rate and alter the depth of respirations, decreasing effective alveolar ventilation. Shallow respirations also increase the risk of atelectasis, which is the collapse of the lung tissue affecting our part of the lung, affecting exchange of oxygen and carbon dioxide. So now you may be becoming acidotic. Interventions that promote respiration and ventilation include planning activities to provide for periods of rest. Tachypnea increases the work of breathing, causing fatigue. In turn, can further impair ventilation and reduce the effectiveness of coughing. So this fatigue can really affect how you are coughing. Elevate the head of the bed. The upright position improves lung excursion, movement from the resting position, and reduces the work of breathing by lowering the diaphragm, moving abdominal contents downward, creating less resistance to the diaphragmatic excursion and slightly decreasing venous return. And it helps you expand your lungs when you're sitting upright. If you lay flat, they feel like they're suffocating. Promote sleep hygiene, airway congestion. You know how you feel when your nose is stopped up and you lay down and try to breathe? It's the worst feeling in the world. And you're just doing everything. I'm a Vicks Vapor Rub lover. I stick it up my nose when I'm congested. But it does work. Airway congestion, malaise, muscle aches, and persistent cough may interfere with rest, increasing fatigue, and prolonging recovery. To assist the patient in getting enough rest or sleep, the nurse may do the following. Assess sleep patterns using subjective and objective information. The patient who appears to be sleeping may not be achieving normal sleeping patterns because of influenza symptoms. Both subjective and objective data are important. Ask the patient, are you actually sleeping or are you just laying there with your eyes closed? Provide an antipyretic for the temperature, analgesics for the pain, and these are to be taken at or shortly before bedtime. These drugs promote comfort by reducing fever and relieving the muscle aches. If necessary, request a cough suppressant for nighttime use. Cough suppressants are not recommended during the day because coughing promotes airway clearance. However, they may be helpful at night to help you rest because some of them have codeine in them and they will help you sleep. And we do need to sleep. Our body rebuilds tissue when it's sleeping and rebuilds cells, and we need to rest when we're sick. Prevent infection. Infection control measures are recommended to prevent individual-to-individual transmission of influenza and to control influenza outbreaks in healthcare facilities. Use standard precautions. Wash your hands. Droplet precautions. Wear a mask or the gown, glove, whatever the precautions are. We use these with patients with suspected or confirmed flu and encourage all staff and visitors to cleanse their hands frequently. Hand hygiene is a primary control measure for infections transmitted via the respiratory secretions. And as I said, we know wearing a mask is very effective as well. Instruct patients and visitors to control respiratory secretions by using tissues and to maintain a distance of at least 3 feet from others when coughing or sneezing. Now remember, this is flu, not COVID. Provide masks for patients and visitors who are unable to control secretions. You need to put one on the patient as well. Limiting the spread of aerolized secretions by covering the nose and mouth and maintaining distance from other people can reduce the spread of the disease to these vulnerable populations. Community-based care. Although the symptoms of influenza are distressing, most people with the illness provide self-care and do not contact the healthcare provider. The nurse should encourage appropriate self-care for patients with influenza and discuss the following actions. Increase rest during the acute febrile phase of the illness. Maintain a liberal fluid intake. Appropriate use of over-the-counter medications such as antipyretics, acetaminophen, something for the muscle aches. Employ hygiene measures such as using disposable tissues and frequent cleansing of hands to reduce spread of the infection. You may want them to have a bag just for their dirty tissues that they keep to themselves so they can put it in that bag and double bag. Know the manifestations of potential complications of flu that should be reported to the primary care provider. And then how do we evaluate? The patient's temperature remains within normal limits. The patient maintains normal fluid balance by increasing fluid intake. The patient's oxygen saturation remains within acceptable limits, and the patient maintains a patent airway. So again, with the flu, it is highly contagious. It is airborne. It's a respiratory disorder, and we need to report the symptoms as soon as we start feeling early symptoms. Hopefully, we can get something in us like Tamiflu to help decrease the number of days that we feel sick. Okay, thank you.